teenagers. And the reason I'm here tonight is because I hadn't seen the ad until one of my patients came in who had been diagnosed 2 months before and had just started hard. Got low T cells, we waited a month, did them again. And he saw it and came in and said, "Why am I taking these meds?" I saw the ad and was very upset. It was very emotional for me because I've been doing this since '89. And then I showed it to more of our kids and they were equally upset and said things that occurred. Why aren't women in it? Women can get anal cancer too and get broken bones and dementia. Why is it just young gay males? So I also have a doctorate and I know somewhat about research. I'm not an expert at all. But a lot of studies are going out. But are these studies of adolescents in the United States that are gay, bisexual, young men of color who are at great risk? So when you have a focus group, does that mean you're including the entire population of young men that fall in this? I don't think that's true. And I'm not sure. I even called the Department of Health and spoke to public relations. No one knew what to say or anything. I got no response about what's going on. I also know that there's studies show of all people, not just adolescents, there's a higher rate of anxiety, depression, and post-traumatic stress disorder in those being diagnosed with HIV. So the scare tactics I get a little concerned about. Also, in my job of doing pap smears and vitamin D levels, of trying to prevent these things, it doesn't give them the full picture of what is done versus getting tested and getting into care.
Thank you very much. So we'll go to the panel. We'll go to Dr. Cutler. I just want to acknowledge that Assistant Commissioner Dr. Monica Sweeney has joined us.
I will say that we have received numerous letters from HIV-positive individuals thanking us for running this app because of some of the things that Tokes had said. It tells you that things are much more complicated than just taking a pill. However, the point that you raised was that rates of anxiety, depression, possibly substance use are increased in people who are diagnosed with HIV and or living with HIV. And that is precisely part of the issue, is to try to have people avoid getting HIV so that they do not have these elevated risks of these other consequences. And many people are also right that one ad can't do every single thing under the sun, and that is not that would be impossible. Advertisers like Les tell us that we have to, in a short 30-second ad that's being run on television, focus on one message. You know, you have to keep it focused on one message because that's what people can grab onto. So that's the message for this ad. But as many people in this room know, because many of the activities that we fund, we do many, many other things, including funding an inordinate amount of HIV screening and testing throughout New York City, at least 42 clinical facilities and 29 non-clinical facilities, funding all of the syringe exchange programs in the city, behavioral risk reduction programs, many, many other things. So you're right that one ad cannot do all of these things. It has to be coupled with all of the other strategies that we're all working on together, that we partner on, and we have been partnering on. And so that's what I would say. I don't know, Dr. Sweeney, if you want to add something to that. Right here?
Yeah. My thing is, okay, I seen the commercial, all right? You don't say that if you don't take your meds, this is what happens. All right, I got grandkids and I got kids. The commercial came on, I'm sitting there. That's the first thing they do, look at me because they know. So I gotta explain to them, no, this is not happening. 20 years, it's not happening. All of the things that y'all say, I take my medical regimen. But you got it on TV that this is what happens when you get HIV. So now they thinking, okay, you're dying. You know what I'm saying? I'm living. I'm not dying. But the commercial's so offensive, it scares my grandkids. You know what I mean? Especially, I'm open with them like that. So it really affects them. Not only do it affect us, but it affects your family. You know, because they believe in one thing in you. Okay, you're living long, you're looking good, you're doing the right thing. But then this commercial comes out of nowhere and just slaps them in the face with it. You know what I mean? So
Thank you.
First of all, I want to thank you for sharing that. That was very brave of you to share. And I also want to say that there are going to be difficult conversations, and there have been obviously very difficult conversations within households, within communities about this. And that is one of the important, in some ways, elements of this, is that we bring HIV out from the shadows where people are not talking about it. And you can talk to your grandchildren about how to avoid HIV by doing other things that would help to keep them safe. So you can be a living lesson, a role model to them, and because you have honest, it sounds like honest communication with them, this is, it's kind of a teaching moment and a moment in which you can shift perhaps the trajectory of their own lives, and that would be an important thing.
Okay.
I think he was for, oh,
That's right, you have a minute?
yeah. So I have to stand for this. Everything that we're saying here tonight is all nice and dandy, but there's two words that I have not heard say tonight, and in all of your literature, all the thousands and millions of dollars you're spending on your literature, you never said the two words. Thank you. To every HIV negative person who's in this room tonight, I want to say thank you. My name is Robert Brandon Sandor. I am the founder of Brandon's Pause Parties, and I am not afraid to stand up on a pedestal and be the first to say thank you on a nationwide scale. You are the reason why all of them have a job, and you are the reason why they get the funding for prevention messages. That's enough of that. For those of you who might have seen me wear this sticker, it's a P for Peace sticker. It means it's the pause code. Not only did I say thank you, but I'm actually enforcing that. That means I would rather have sex with my own HIV status than to be held liable for infecting one of you. So not only am I HIV positive, but I'm not afraid to announce it to everyone. I've taken HIV prevention, those of us who are familiar with the pause code, the P for P code.
Thank you.
Okay.
Can you wrap up? 'Cause there's
Oh,
a
yeah,
lot of other
okay.
questions.
Yeah.
Find all this information on my website, pauseforpause.com. That's P-O-Z, the number 4, P-O-Z.com. And for you who are HIV negative, I'm working on you this year. You have something coming.
Thank you. Okay, Royal, and then this guy in the stripes.
Good evening, everyone. My name is Oriol Sams, and I am, among other things, a proud member of GMHC. I want to thank the panel for coming. In one sense, I think, ladies and gentlemen of the panel, you're sort of preaching to the choir, but I have two questions, because when I saw this flyer last week, I saw the bullet points, scare tactics worked, and the other one on HIV prevention. And so far as the scare tactics, if one picture is worth 1,000 words, I think some of the campaign ads say it all. Some work, some don't. As you mentioned, you only have 30 seconds to get this. You walk down the street, there's an ad here, there's an ad there. One says one thing, one says another. You only have the 30 seconds to get that message across. And the attention span is very short. Scare tactics don't work, in my mind. Short term, yes. In the long term, no. Now, charity begins at home. I think we can do two things here at GMHC. We've already done it. I love my boo, and HIV stops with me. You know what I'd like to see? I'd like to see a panel presentation on those, at least those two. I think it's 3, but I think it's those 2. A presentation and panel discussion with the units with here in GMHC. Not just the play cards and the palm cards and the posters and whatever, but honest to goodness conversations. And my second, I want to say it for Dr. Sweeney.
Okay, thanks, Roy. Any reaction from the panel? Anyone on the panel? So the next person is Sir with the orange striped sweater.
You know, Les, I'm really glad that you made those remarks about talking about negative men and HIV negative men, because I feel that as a negative man here, I recognize that the GMHC is an AIDS service provider, but there's nothing for me here. And I think that's the one problem with AIDS service providers is that their jobs, I think, are essentially to provide services, and that's largely around testing and early intervention, but not doing very much to prevent infection. You've got these messages, these things, but I'm 49 years old, and I'm really sick of looking at younger men in these messages. Where are the messages for the rest of our community? You made us invisible. AIDS service providers have made us invisible, and there's no discussion about the fact that we have a multi-generational gay community, and that perhaps somewhere in there's an ability to be able to get these different generations to work together about doing something around prevention. But it's really distressing to me that there aren't any services that, other than the same old tired support groups that exist. And, quite frankly, at this point in my life, no interest in having another conversation about who's the top or who has the most power in the relationship, the top or the bottom. But that's where the dialogue and the discourse is. What are you all going to do to change that?
Thank you. You raise a really important point. I just want to respond to one thing you said. You're absolutely right that there need to be more prevention campaigns from the City Health Department, the State Health Department, the Center for Disease Control, aimed at older adults. And this is something that we've been working with all three levels of government on for a while. And it's one of the key recommendations in this report about older adults and HIV, which is about both prevention and care. And even though, most of the services we provide here are care services, we really want to prevent people from getting HIV in the first place. And so,
But it's not just older men, it's, trans men, it's,
yeah, I realize. Trans women, actually, mostly trans women.
That's right, overweight men, bears, whatever.
You're right. You're right. It shouldn't just be, it should be all different images. Absolutely. So I just want to also mention that this is on the U.S. Administration on Aging website now, and we're really hoping to see some, results soon from the CDC. We want to see some funding dedicated to older adults, prevention of older adults, because about 1 in 6 new infections occur among somebody 50 or older.
Are you all advocating for them?
Absolutely, all the time. Anyone else want to respond, or there's a lot of questions in the audience. So let's hear from Dr. Cutler, and then we'll go to another question.
Just a real quick comment. Since we're talking about prevention messaging specifically for negative men, I would love to see real conversation around talking about actual risk.
Yeah.
And that kind of speaks to my criticism before about the use of a condom every time. Let's talk about actual risk in these prevention messages. I think that would be very helpful.
I only wanted to add one comment about older HIV and older adults. One of the important measures looking at the issue about this, it shifts the dialogue a little bit toward testing, but when we look at our data around concurrent diagnosis, meaning being diagnosed with HIV and AIDS at the same time or within a month, for older New Yorkers, the rate is upwards of 39 to 40%. So that's also indicative of waiting many, many years to be tested. Higher than the national city rate of about 23%. So that speaks to the issue about needing to do more work around older adults.